Hi, here is an essential level Pilates program for September. So we're going to start off with our prep and standing, and I'd like you to stand in parallel. So hip joints, knee joints, ankle joints, all in a straight line to each other. Pelvis neutral, so the bones at the front of the pelvis are flat and level vertically because we're vertical, and this should give you a gentle curve in your lower back. Now we're going to keep the gentle curve in the lower back, drop the shoulders back and down, extending the crown of the head to the ceiling. And then I should like you to take your right hand onto your sacrum and your left hand on top of your right hand and squeeze your elbows back towards each other. This will feel like there's now a stretch in the front of your shoulder running into your arm. Please keep that feeling of your elbows squeezing back towards each other and sit back into squat, maintaining the pelvis and spine in neutral before coming through to standing. Again, sitting back into the squat. We do want to use a lot of hip extension here with our squat, making sure that we're sitting back into the heels. You can wriggle the toes at the bottom of the squat. So your weight is going backwards. You're using your buttocks and you're maintaining the neutral spine as you sit it back. Have you remembered to be squeezing your elbows back towards each other? Well done if you have, and you have managed to keep that feeling of slight stretch across the front of the shoulder capsule into the arm. Well done. Now it's important with our Pilates squat that you only go as low as you can maintain your neutral. We'll go for 2 more. And then when we finish the last one, back to standing, releasing the arms to the sides. Now we're taking a tap back next with our right leg. So I should like you to take your right leg back so it's straight, raising your right arm at the same time. Bring it back to center, right leg again. So it taps, the shoulder extends on the same side, and we return. We tap and return. Now this front knee is bending and extending. So when you look at the front knee, it should be going over your toes, toes 2, 3 and 4. And you should be keeping the arch in that front foot when you tap back. That back leg should be straight as we swing the arm. We'll go back twice more. And then on the last one, we're keeping the leg back. We're releasing the arm down, keeping the torso vertical to bend both knees and straighten both knees. Now this is a static lunge. It is important that you do not lean forwards and that you keep your torso upright, and it will feel like your legs are working incredibly hard because they are. Now this time when we get to the bottom of the lunge, we're going to hold it. You're going to do a rotation towards your back leg and then return. Same again, rotate towards the back leg. Now as you are rotating, I want you to make sure that your front leg stays still and your back leg stays still. There will be a bit of a pull and a bit of a stretch into the hip on the back leg as you are rotating, and that is what we want to feel. You're also getting some thoracic rotation here as well. We'll go for 1 more, and then we'll release, coming back to parallel standing. Reversing everything that we've just done, we're standing in parallel in neutral with our left hand on our sacrum, our right hand on our left hand, our elbows squeezing back. We sit into squat and drive through to standing, maintaining the neutral line of the spine all the time, and again consistently squeezing your elbows towards each other so that you can feel that stretch and opening into the front of the chest. Using buttocks as you drive through to standing. So we're practicing maintaining our neutral spine as we bend at our hips, at our knees and as our ankles. Remember that if you are picking things up in your everyday life, it is really important that you use correct lifting action, maintaining your neutral spine and using your legs as your powerhouse. We'll make this our last one, and then we're tapping back, this time with our left leg, and our left arm is coming up into shoulder extension. So it's a straight leg going back and together. A straight leg going back and together. So it's the leg going back, arm on the same side, goes up into shoulder extension. Front knee bends over toes, 2, 3 and 4. Arch is preserved on that front leg. And again, the torso stays upright. So what we don't want is we don't want our torso leaning forwards like this. We want the nice vertical torso as we go back. We'll stay back on the next one, going into bending both knees, straightening both knees. So as we bend, arm goes up, straighten, arm goes down. Again, we're staying upright, so just check here. If you've got any tightness in the hip joint, especially on that back leg, what your body's going to want to do here, again, it's going to want to lean forwards. That takes the work out of the back leg. It takes the stretch out of the hip joint. And we actually want that hip joint and that back leg to work hard. So even though you may feel like you don't want to, try to stay upright. Do both of those knees bending down. We'll stay on the next one in the bent knee position. And again, we are rotating side, centre, side and centre. So you will feel a little bit of a pull through that hip, left hip this time, leg that's behind you, as you're rotating. Twice more through, and then last time, and release it. Wonderful work. Now the next thing we're going to practice is a golfer's lift, and this is a really, really useful technique that you can use in everyday life to pick up very, very light things, maintaining a neutral spine. So with our golfer's lift, we're using the hip extension that we have been practicing. Let's start off standing on the left leg and taking the right leg behind. Now for this, depending upon your flexibility and your range of movement, you may or may not be able to touch the floor. It isn't touching the floor that's important, it is maintaining your neutral spine, okay? So I'm just going to use this block. So right leg back, pop something into your hand. Now your standing leg can either be straight. If it is likely that this exercise will cause a hamstring stretch down that straight leg. So again, in the case of sciatic nerve irritation, I'm going to say work with a bent knee, okay? So bent or straight. Right toe behind and spine in neutral. Now your hand doesn't matter, that is personal preference, okay? So what we are going to do is maintain that straight line, crown of the head to the tip of the toe on the back leg. I'm going to touch down and come up. Again, touch down and come up. So my personal preference is same hand to the leg that goes behind. Touch down and come up. So this is really important, that when you're touching down, you don't do this. This is wrong, okay? You use your hip joint as a pivot. So your pelvis pivots on the top of that thigh bone as you go down into your golfer's lift. One more. Wonderful. And then what we'll do is we'll do the same but reverse it. So standing on your right leg this time, take your left leg back. Now you will have a personal preference as to which side you stand on to do this in your everyday life, but do try to have some balance And make yourself do it on your non-preferred side as well. Okay, so straight. We're down into that golfer's lift. It's really handy if you have got a mirror to actually practice this one, because you can actually see what's going on. Are you keeping your heel, your pelvis and your head in a nice straight line with each other? Or are you leaving your leg behind and doing this with your back, which is not right? So that's definitely what we don't want to be happening. One more on this side. Wonderful, wonderful work. Okay, shoulders. I'm just going to come down to kneeling. We're going to roll our shoulders back. You can stay standing for this if you want to. It's just that my hands will disappear off the top of the screen if I stay standing for this one. And then what I would like you very much to do is keep your shoulders rolled back and down like this, okay? So they're set further back, and float your arms up. Release your arms down. I just want you to notice where you can get your arms to when you've got your shoulders back and down. Now, I've got quite mobile shoulders, and I can get my arms really, really high when I've got my arms back and down, okay? So I can actually get my hands behind my head. You might not be able to, and that is absolutely fine, but just notice. So hold them there on this last one and notice where they are. Okay, let's release it. Now we're going to do reverse. Roll your shoulders forwards, roll them forwards, roll them forwards. This time we're going to keep the shoulders forwards, okay, so that we have separated our shoulder blades. The shoulder joint is definitely forwards of our ear. And I want you to try to raise your arms in that position with your shoulder blades separated and your shoulder joint forwards. Now you might notice that my arms are going nowhere near the range of movement that I managed with my shoulders held back and down. So here is a beautiful shining example of one of the things that we're trying to promote with Pilates. It's shoulders back and shoulders down. Okay, come back, just give your shoulders a shake. So if you can manage to keep your shoulders back and shoulders down, the range of movement that you have at your shoulder joint is much bigger than if your shoulder blades are separated, rotated forwards, and that shoulder joint has moved forwards. So if you do have issues with lying on your back and trying to get your arms over your head when you are lying on your back and they don't go there, it is probably to do with the muscles around your shoulder girdle. So they need to be worked on to strengthen and stretch. Okay, lovely work. Moving on from our shoulder rolls, we're going to do some wide leg squats next. So we take it as wide as you feel you can go to with this one, and we're circling the arms, and I should very much like you to alternate which arm goes in front when you're doing those wide leg squats. Knees going out over the toes, and we should get quite a deep stretch into the inner thigh as we are going down into our squat position. Making sure that we preserve our arch. So if our knees roll forwards like this, then the arch flattens and our weight goes towards our big toe. That is not good. Send your knees out over your toes so that your weight goes towards your little toe. 2 more wide leg squats. And then on that last one, we're going to hold the squat, hold the arms out. We're doing some side bends from one side to the other. Now you're going to have one hand as the static hand and try to reach towards it. Release it back to T. Opposite hand as the static hand, try to reach towards it, release it back to T. Reaching, over, releasing, back. Reaching, over, releasing, back. What we don't want is we don't want this arm going down. So it is the fixed point that we are stretching towards, and we're getting a beautiful lateral flexion as we go over. Once more in each direction. Our legs will be working extremely hard at this point now because they've been statically contracting. And when we have finished that one, if we release it up. Okay, we want quite a deep squat. So take quite a wide stance for this one. And this is just going to illustrate what happens with your back as a normal phase of squat, okay? So we can squat to a certain degree, keeping our spine neutral. And when we go lower than that, what will normally happen is we will get some flexion of our spine and our back will round. Okay, that is normal, that is absolutely fine. That is exactly what should happen. Come to seated. Now you might find that you can't squat to seated. That's absolutely fine. Take yourself to your seated position in any way that works for you. And when we get to seated, we're setting up parallel ankles, knees and hips, supporting at the backs of our thighs, and we're doing the exercise that we call I2J, which is a seated pelvic tilt. Stay with this one if you're currently rehabbing from disc issues. Hold your J position if you're free of disc issues. Take the arms off, and then we're rolling back and rolling up for the half roll back. Exhale back and inhale up. Now our half roll back is an inner range rectus abdominal holding exercise, in that the rectus abdominals are holding our spine in flexion. We are using our hip flexors. They are the dynamic moving muscles in this exercise, and they are rolling our pelvis towards the floor and back up again. Now that makes it more challenging. The angle that our torso gets to makes it more challenging for those rectus abdominal muscles to stay contracted. So although the hip flexors are moving, it's the static contraction of the rectus abdominals, strengthening those muscles as a deep lumbar flexor. That is the aim of this exercise. We'll work one more repetition, and then we're coming up to seated for spine twist. Now with the spine twist, if you can sit in neutral, i.e. get up on your sitting bones, have a little bit of a lumbar curve. It will be flattened when you are seated compared to when you are standing, and work quite comfortably with your legs out straight, please do so. However, if your legs are straight and your back is like this, that is not a good position to be in, okay? You're diagonally upright, you're not vertically upright. So we need you to be vertically upright. You may find that if you bend your knees, cross your legs, or place your feet together, those positions allow you to stay vertically upright. Or you can sit up on a block for this one, and that will allow you to stay vertically upright with, again, all those options in leg position. So we're going to practice the spine twist in seated. It's a rotational exercise, and I would like you to pop your hands into a prayer position like this, with your thumbs tucked to your breastbone and your fingers tucked underneath your chin. Roll the shoulders back and down to open the chest, and then moving your shoulders, you're rotating side to side, and this will isolate thoracic rotation. It is likely that you're going to feel the movement in the vertebrae that are sitting underneath your shoulder blades, because our shoulder blades are kind of retracted in this position. We'll do two more, and then last one. Okay, so carrying over the fact that our chin and breastbone are going to stay in a straight line, let's change our arm line to a W and continue to rotate. So you're not moving your head at the neck. The only reason your head is moving is because your torso is twisting side to side. Now you'll probably notice with arms in this position, your movement and rotation increases a little bit, and that's because of the position of the arms. They've changed where our shoulder blades are. So if we change arm position again, take hands behind head, squeeze elbows back, keeping all of the same principles that we've been working on. Chin, breastbone in line. We'll probably find that as long as you can get your elbows back, and again, that is to do with the stretch in your shoulders, your rotation has increased again. We'll go one more to each side. And then when we finish our last one, we will release and come back to seated. Spine stretch forwards. Place your hands onto the mat either side of your body. Now we're going to work spine flexion from seated. This is a loaded exercise. So any nerve issues, very important that you bend your knees for this one and you work through your pain-free range of movement only. You're going to imagine that you're sat bolt upright against the wall, and from the top of your head, working down through your spine in sequence, you flex forwards until you feel stretch in your back, and you pause, and then you stack back up, pelvis to neutral, spine on top of pelvis, okay? So if you know nerve issues, you can work legs straight. So we exhale to flex forwards, rolling from the top of the spine towards the bottom of the spine, feeling the stretch into our back. Imagine that you're trying to put the top of your head onto your legs. Inhale, roll up. Exhale, roll down. Inhale, roll up. Exhale, rolling down. Inhale, rolling up. One more time through, please. Exhale, rolling down. Inhale, rolling up. Now we are going to work on our back on the mat. So I should like you to get there safely. Once we get on the mat, we'll be working with pelvis and spine in neutral, and we want to strengthen all of those muscles that are going to support the neutral. Our exercise will be knee folds. Any issues with your back? It's always less stressful on it to come to your side first. So we place pelvis in neutral, bones at the front of the pelvis flat and level with each other. Our ankles, our knees and our hip joints are in straight lines with each other, and we have a right angle at the knee joint. Press the shoulders back, opening the chest and pushing the arms flat to the mat. In this position, if it feels like your chin is sticking up into the air like this, it is very important that you place a small pad underneath your head, rock your head into chin tuck, and that should correct head and neck alignment. Now we're going to hold the neutral for the knee fold. And with the knee fold, our moving muscle is the hip flexor. Our static muscles are pelvic floor transverse, all the muscles in the abdominal wall, all the muscles in the back. And we are maintaining the pelvis and the back in the neutral position against the load of the leg as we pick it up into what we call tabletop. So you're either going to practice this one at single knee fold level, remembering that you must be able to keep your pelvis still. Alternatively, you'll be moving to tabletop through a lift, lift, lower, lower movement. Or for those of you who have got awesome core strength, you're moving into and out of tabletop with both legs simultaneously. It is very important and it is vital that you keep your lumbar curve. Please do not work at a level that's too difficult using your back and a pelvic tilt like this. If I take my arms away, you'll see what happens, to bring your legs into and out of tabletop. So this is not correct to do this, yeah? Think about where your pelvis touches the floor. The same part of the back of your pelvis should be touching the floor at all times. We're going to hold tabletop when we get there this time, and we'll be practicing the Pilates 100. We rock our head into chin tuck. Now, any neck issues, keep your head down on the floor, float your arms only. If you're free of neck issues, the head, the shoulder blades and the arms come up, acting as a load for the neutral pelvis and neutral spine position. So when you've lifted, if you have flat back this, that's wrong. Correct it. Get the curve. One leg out, 50 beats. Breath in, 2, 3, 4, 5, out, 2, 3, 4, 10, in, 2, 3, 4, 5, out, 2, 3, 4, 20, in, 2, 3, 4, 5, out, 2, 4, 30, in, 2, 3, 4, 5, out, 2, 3, 4, 40, in, 2, 4, 5, out, 2, 3, change legs, in, 2, 3, 4, 5, out, 2, 4, 60, in, 2, 3, 4, 5, out, 2, 3, 4, 70, in, 2, 4, 5, out, 2, 3, 4, 80, in, 2, 3, 4, 5, out, 2, 4, 90, in, 2, 3, 4, 5, out, 2, 3, 4, 100. Tuck the knees in and rest down. Remove your head pad if you have been working with one. We are going to shoulder bridge. So we peel through into our bridge. Now, if you have any issues with pelvis instability, I would like you to hold bridge and do alternate shoulder extensions. So you're taking one arm at a time over your head, and we'll do that 4 times. When we've completed the 4 arm extensions, we roll out of bridge. And then we'll repeat it, rolling up into bridge. Okay, so carry on with your arm extensions if you have any issues with pelvic instability. For those of you who are free of pelvic instability, your challenge will be to hold the top point of your bridge and to do 4 alternate knee folds without losing any height of your bridge and without letting your bridge twist or rotate. Once you've completed your 4 knee folds, then you are going to roll yourself down out of your bridge. And then roll yourself back up. So it's 4 arm extensions or 4 knee folds. Please choose the most appropriate level for you. And the important thing is that you hold the height of the bridge. If your bridge starts to drop like this, or twist like this, then that is incorrect, okay? The bridge needs to be in that straight diagonal line. Let's roll down. Roll up again. Arm extensions or knee folds. We'll go 4, release, 3, release. The bridge, it's all about buttock strength. 2, release, and 1. Release. We're rolling down. We're going to do that twice more. Knees are important. Make sure when you go to bridge they don't separate like this. You keep you parallel. Knees or arms. 4, release, 3, release, 2, release, and 1. Release. Rolling down. 6th and final repetition, rolling to bridge, hold it, 4, release, 3, release, 2, and 1. Wonderful, rolling down. Okay, from there, let's turn onto our side, and we are going to practice our side lying obliques. So if we take it out into a straight line, placing one hand in front and gluing our legs together, we engage our core, and on the out breath we lift both ends of the body, making sure that our legs stay adducted and parallel. In breath we lower, out breath we lift, in breath to lower, out breath to lift, In breath to lower. Continue with this. Working here on the space between your armpit and the mat. So you are actually laterally flexing your spine as you come up. Four more times through. Work should be here, into the waist on the lift. Now you're also getting outer thigh and inner thigh with the legs. So if the hip muscles are balanced, then it will be reasonably easy for you to hold your legs parallel and adducted. If you have any imbalances in those muscles, this is going to be really tough. Last time through. Releasing. Okay, we're going to transition onto our back and we're going to work the knee roll exercise once we are on our back. So we're gluing our legs together, bringing our arms with our shoulders back and down into a W position. If you find that this is difficult for you to get your forearms onto the floor, then it is important that you put some blocks of the appropriate height underneath those arms so they allow you to get your arms out and to keep the forearm and the back of the hand flat. You want to avoid doing this with your arms, okay? So that's showing that we haven't quite got the mobility, if you're working in this position, to actually get the forearm down. So use a block if that is the case. And over time, if you are keeping that nice and flat, your flexibility will improve. So legs are glued together and adducted. We are rotating pelvis, knees and feet side to side. The W arm line is going to put a stretch through the muscle called pectoralis minor. And if your shoulder girdle does actually have any imbalances, then this will be quite a difficult position for you to get into. However, it is quite important that you try. So anything that we're stretching, so we're stretching pec minor here, it needs to feel uncomfortable rather than painful. And if you use blocks that are the correct height underneath your arms, just to lift them a little bit so you're at the uncomfortable position, if this is painful or if that is not achievable, then that will be really useful and much better than doing something like this or something like this. Once more in each direction. And then we will release. Okay, so full body stretch. Let's focus, see if we can get those shoulders back and down and arms overhead. So you're putting into practice that little bit in our prep that we were practicing with the shoulders back and down in order to try to get the arms as high as you possibly can. Releasing. Side lying obliques facing the opposite way. I'm going to turn my back to you. So our legs are glued together. As we exhale, we lift everything up. As we inhale, we release it down. We'll go for 4 more on this side. Last 2. And last 1. Wonderful work. Okay, so if we push up, we're going to side saddle position for side bend prep. Now we're going to load the shoulder with the side bend prep. So our position in our contact points is heels and hands in a very, very shallow V position Okay, so our pelvis is the bottom of the V, our heels are at one end and our hands are at the other end of the V. Okay, so that's our contact points with the mat. Feet far enough away that your outstretched arm is wrist on your knee. If you're in this position, your feet are too close, they need to go further away. Top knee rotated to the ceiling, and your bottom knee and your bottom calf are going to stay on the mat as we laterally flex the spine and load the shoulder before releasing down. We laterally flex the spine, we load the shoulder, we release down. So you've got a dynamic range of movement, strength exercise here for the shoulder, that is weight bearing. We'll go for 2 more repetitions. And note that your arm stays long across the elbow as it reaches over your head. You don't let it bend. Swing legs round. Let's do the same exercise facing the opposite way. So setup's the same. Shallow V, hips at the bottom, feet at one end, hands at the opposite end. Okay. Out breath. Takes us over. In breath, release. Out breath. Takes it over. In breath, release. 2 more on this side. And last one. Well done. Okay, coming to the front of your mat. So your hands are at the front of the mat. We're in 4-point kneeling. Hands are under shoulders, knees are underneath hips, and our spine is in neutral. Please remember to use a chin retraction movement here to keep the back of your head and your neck aligned correctly. If you let yourself go into chin poke and chin protraction, then your head and your neck are going to fall out of line, and this is incorrect. So we retract. You're keeping the little curve here and drawing the abdominals in. So again, when you draw your transverse abdominals in, if you find that the shape of your back, your lower back changes like this, that is wrong. Okay, that's your rectus abdominals acting as a deep spine flexor. So we want transverse abdominals acting as a spine stabilizer. So you can see the soft tissue of my abdominal wall lifting, and you can see that I'm managing to keep the curve in my back when I lift that. All right, that is the essence of this exercise. If you lose this or this, take a break. We're going to extend one leg back so it's straight. Toe goes down. Stiffen that straight leg. Extend the other leg back so it is straight. Now that's put us into plank position. Be careful of your head and neck position. Remember, as soon as you start to protract your chin like this, you're not doing the exercise correctly. You need to either stop, or if you can fix it, do fix it. So it's quite hard work to stay in this position. We'll see if we can hold it for a few more seconds. And then we'll release back to 4-point kneeling. Okay, now some of you will have found that that was really, really testing. If that is the case, what I should like you to do very much for your next exercise is to lie down on your tummy like this, tuck your toes under and tighten your thighs, and then maintaining your pelvis still, you're going to do hip extensions from a prone lying position. Okay, for those of you who found that was pretty easy, and there might be a few of you, especially if you've kept your practice up, we're going to abdominal hollowing, neutral spine in 4-point kneeling. we're stepping back, straight leg 1 and straight leg 2. And then from there, we are going to do our hip extensions, not from a prone lying position like anybody else, but from a plank position. However, if you're doing this and your bum starts to do this when you lift your leg up, that's wrong. You must be able to stay in your plank position. This is right. To perform those hip extensions. We'll go one more on each side. Wonderful work. And then we'll rest it down. Okay, we're face down. Little pad underneath your forehead, or folded up hand towel is quite a nice size if you don't have a little pad. Let's work on our shoulder girdle and the muscles that are going to keep our back nice and strong. Breaststroke preps, please. W arm position for your stage 1 prep. We'll exhale, slide the shoulder blades down the back. Inhale, peel the face and chest away from the mat. Exhale, release the chest and face down to the mat. Inhale, release the shoulders to the ears. Exhale, slide the shoulder blades. Inhale, peel the face and chest. Exhale, release the chest and face. Inhale, release the shoulder girdle. Exhale, slide the shoulder blades. Inhale, peeling. Exhale, releasing. Inhale, letting the shoulder girdle go. Sliding the shoulder blades down the back. Peeling the face and chest up. Releasing chest and face down. Releasing shoulder girdle. Let's do 2 more repetitions. Exhale, slide. Inhale, we've got neck and upper back extension. Exhale, release the spine. Inhale, release the shoulder girdle. Last one. Exhale, slide the shoulder blades. Inhale, peel the face and chest. Exhale, release the chest and face. Inhale, release those shoulder girdles. Stage 2, hands are by hips. Shoulder girdle retraction, external rotation of the shoulder joint and lumbar extension this time. Exhale, squeeze shoulder blades, rotate elbows and palms in. Inhale, float. Think about reaching your hands down towards your knees. Exhale, release. Inhale, let the shoulders go. Exhale, shoulder girdle, shoulder joint, nice and tight to the body. Keep it low. Float. Make this discreet. Release. Relax. What we don't want to see is arms up here, and we don't want to see spine up here. Yeah? The other thing that we don't want to see is neck doing this with this one. All comes from the lower back. So we go shoulder blade, shoulder joint, lower back, float. Release lower back, release shoulder girdle. Shoulder blade, shoulder joint, lower back, float. Release lower back, release shoulder girdle. Last time. Shoulder blade, shoulder joint, lower back, float. Release lower back, release shoulder girdle. Now we are going to follow our breaststroke preps with a shell stretch. Now, in this variation of shell stretch, what I would like you to do is have your right arm forwards and your left arm just underneath your head, please. So you sat back, as you would be anyway, onto your heels, crouching as low as you can. Left hand under the head, right arm forwards. And I want you to notice the stretch that you're feeling. And really try to reach forwards with that right arm. So if you find it's difficult to get a straight arm forwards, you might find that if you use a block and pop your arm onto a block, and again you can use your block in whichever direction you need to, you can get the straight arm forwards, and it actually allows you to get a much better stretch. So do use something to prop your hands up onto if you need to. Okay. We're going to release and we're going to reverse that stretch. So same stretch, but this time right hand underneath head and left hand reaching forwards, and really try to stretch out through that left. Breathing softly.
Notice how it feels. Does it feel exactly the same but in reverse to when you had your right arm forwards? Or are you feeling completely different things on this side? Use that nice big deep breath, breathe in and out, relax into it. One more breath in. And breath out to release. Lovely. From there, let's bring ourselves up onto our elbows for some hip extensions. We're going to work onto our glute max next. So elbows front to shoulders. We're doing one potato, two potato with our fists to prop our forehead onto. And as long as we've got elbows under shoulders and knees underneath hips, then our spine will be in neutral. If you have yourself too close, your spine's going to be flexed and there's no way that you're going to be able to get into neutral spine, okay? So the neutral's always important with our Pilates practice. Keeping the pelvis flat and level, imagine you've got a cup of tea balanced on that pelvis. Take one leg out straight. Keeping it straight, we lift, lower, lift, lower, lift, lower, lift and lower. For 4, for 3, for 2, and 1. Stay at the top. Pulse. 8, 7, 6, 5, 4, 3, 2. Stay at the top. Bend it in, out, in, out, in, out. Definitely no shaking it all about, although you might find some of your muscles are shaking. 2 more. And then on the last one, hold the knee at a right angle and push, 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 push. Imagine you're trying to press your heel onto the ceiling. 8 more. Pressing 8, 7, 6, 5, 4, 3, 2, and 1. Remember which leg that you've just had in the air. Come up onto your hands and give me a cat stretch. Flex, extend. Now, if you're not comfortable kneeling, that whole sequence could have been done lying down on your tummy, okay? Do another couple of cycles of cat. And then we'll work the other leg. 1 more. Okay, lovely work. Okay, let's drop this down onto the elbows. 1 potato, 2 potatoes. I'm going to reverse my potatoes this time. And then reverse the leg. Straight leg raise. 8, 7, 6, 5, 4, 3, 2, 1. Pulse at top. 8, 7, 6, 5, 4, 3. Bend the knee, heel comes in, out, in, out. So you're trying to keep that thigh still in space, so your movement is limited to knee flexion, knee extension only. Hold the knee at a right angle. Imagine you're pushing heel to ceiling, heel to ceiling, heel to ceiling, heel to ceiling. 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Okay, lovely. Lying down on your tummy, legs wide. Big cobra stretch. Up onto those elbows, extend the spine. Just breathe into it. Try to keep the neck nice and long here as you hold that extension. Wonderful work. Okay, let's go back. Shell stretch. Take a wide knee with shell this time, getting a little bit of inner thigh stretch and allowing the arms to lengthen forwards. Releasing from the wide shell, bring the knees together. You come into a split position,
So you've got ankle, knee and hip, yeah, right angle, hip, knee and ankle, right angle. You're going to tuck tail between the legs. And stretch is going to be in this hip. Bring the arms together, taking the shoulders back and down, reach. Keep that pelvis tilted so that you maintain a good stretch into the front of the hip for 5, 4, 3, 2, 1, and then we'll release. Okay, from there you're going to put the opposite hand down onto the mat, and then you're going to rotate. Holding for 5 more seconds. 4, 3, 2, 1, and release. Now we're going to change the hip flexor stretch. If you sneak this leg further forwards and then you lean into it, you're going to feel a stretch down the front of this thigh, which is, again, it's in the hip flexor quadricep region, but it's quite different to the stretch that you got when you were tucking your tail between your legs. If your kneecap feels at all uncomfortable, it is okay to do this. Now, if we keep that front leg forwards and shift our weight back, we're going to get stretch into hamstring. And I do want you to try to create your lumbar curve when you do this. So I've got to come up to here to have my lumbar curve. Can you see the difference? Flexed, and then we've got it, yeah? And that's a nice hamstring stretch down the back of that leg. Okay, if we come up and you just pivot, then you're going to get a long adductor stretch down the inside of this thigh. Adding that side stretch over, and when you go towards the long straight leg, you'll feel the stretch down the thigh increases. Whereas if we go in the opposite direction, the stretch decreases. From there, we are coming to seated. We'll do the short adductor stretches. So we take our feet together for this one. You're looking for balance in terms of the height of your knee joints. Can you see that? There's no balance there. I've got to push that one down. So if you're pushing down, you can either do elbows on the inside of your thighs, or you can do just as I did and just press one knee down if it's just one knee that needs to go down. And we'll release. Seated hip rotator stretch, and again, it might be worth sitting up on a block for this one if you do find that actually getting to seated neutral is not achievable. The block will help. We'll cross one leg over the other, and you're looking in the direction of that bent knee, sitting up so that the spine is tall and straight. We'll release it from there and we'll go the opposite way. Keeping that visualization of lengthening crown of the head towards the ceiling. And then we'll come back to seated. Now this is the complete opposite of the spine stretch forwards exercise that we did earlier when we were really working here on spine flexion and then restack into neutral. Imagine that you've got a hinge joint at your hip, okay, and lean into it.
hold it. So some of you will get further into your lean than I will. Some of you won't get quite as far. For some of us, just even sitting upright there is going to feel like a stretch. So as long as it feels uncomfortable, this will be the backs of your legs that this one feels uncomfortable. It's not painful. Remember, if you've gone to pain, you've gone too far. Okay, let's release it. So we're repeating the kneeling stretches. Opposite leg goes forwards and your tail's tucked between your legs. We bring the palms together, making sure our shoulders and back are down. We reach to the ceiling. We release the arms. We take the opposite hand to the foot down and we rotate. Think here about trying to turn your chest towards your inner thigh. And then we come out of our rotation. Now this is where we're going to sneak that front leg further forwards. So we take it really, really far forwards and then we lean into it. We've got stretch on the back leg again, the front of the hip joint running down into the thigh, but we get a slightly different aspect to the stretches. Now I'll be turning my back to you for this one as we go into our long adductor. Remembering that when we take the stretch over towards the long straight leg, stretch down the inner thigh increases. And when we take it the opposite way, the stretch decreases. Releasing it from there, we are going to bring it back to our kneeling position. Now you're going to use lunge to stand up, okay? So tall spine, best foot forwards unless you really want to challenge yourself, and then put your non-dominant leg forwards. I've got my non-dominant leg forwards. Toe on the back leg, tucked under, and then we drive to standing. Super work. Now I hope you've really enjoyed that one. There was a lot of focus on what we're doing with our arms, what we're doing with our shoulders, and again we really looked at if we've got the tendency to let the shoulder blades separate and the shoulder joint to hang forwards, how difficult it is to actually get your arms to lift up into the air, whereas if we can open the chest, then it's a lot easier to get the arms up. Fantastic work.